I am going to start the recording here. Okay, so, and you can still see my screen?
Yes.
Okay. All right, so this is chapter 2. So if you're looking in Connect or in your actual textbook, if you have one, there's only like 4 or 5 things I really care about. And this is the first one. So it's this little picture, and it's as items go from smallest to largest or largest to smallest. Okay, so the smallest structure of life happens to be a good old atom. So we get to A&P1 next semester, we'll talk like electron, protons, neutrons, right? That kind of crazy stuff. Okay, but that is the atom. All right, when more than one atom joins together, we refer to it as a molecule. When molecules join together, it's the teeny tiny parts of your cell, which is called an organelle. Those are found in your cell, so those make up your cell. When multiple cells join together, it makes up tissues. When tissues join together, they make up an organ. Organs never work alone. Okay, they always work in systems, right? So it's multiple organs usually to one system. And then all of your systems together make up you, which is an organism.
Mm-hmm.
Okay, so questions on that? Because that's just a pretty
No.
straightforward. Okay. All right, then we're going to get into some more difficult kind of concepts. I'm going to kind of go a little out of order here, but I'm going to show you this fancy little picture. Okay, so when a patient comes into the office, there's a couple of ways when we're talking about the abdomen to sort of divide it. And unlike, say, the arm or something else, right, the abdomen, I mean, they can say my stomach hurts. Number one, it's not really their stomach because their stomach is like a specific organ. But it's kind of like this big area, and it could be sort of a lot of things, right?
Uh-huh.
So we sort of subdivide it so that as you're doing like patient notes, you can be specific, like have the patient point to the area that's bugging them, and then you in your notes would write one of the following terms. So we're going to start with this one on the left, which is called abdominal quadrants, and quad, Q-U-A-D, right, is the prefix for 4. So we essentially just put like a plus sign in there, okay? And we just label this the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. Okay, so my only question is, why is this side the right and this side the left? Because that doesn't seem like that's right.
It's viewed the opposite way, right?
It is, so it is opposites. But why? Because this
I
is
don't
our
know.
left if we're looking at it like on the paper. This is our right if we're looking at it on the paper. But this we're calling right. This we're calling left.
Because if I turn my body the other way, that is my right and that is my left.
Perfect. Okay, so that's patient right, patient left, right? So that's your patient's right upper side, their right lower side, their left upper quadrant, and then their left lower quadrant. Okay, so perfect answer. So this one we often abbreviate our UQ, right? Our LQ, LUQ, LLQ, right? So if you see abbreviations for those, and I think I have them on the word list here for chapter 2. So, right, if you see like LLQ, right, LUQ, those are the abbreviations for those. Okay.
Okay.
All right, then we have what I like to refer to as the tic-tac-toe board. Okay, here on the right, and I'm going to show you just a slightly better picture. I'm just going to Google one because I'm sure there's a slightly better picture. All right, we often refer to this as abdominal regions, right, when we're looking at this.
Mm.
And essentially what we do is we divide it into 9 sections. as opposed to just the 4. So it just allows us to get a little bit more detailed, okay, as we're looking at it. So we'll start with those center couple of sections, right? And that very center one is referred to as the umbilical region. And umbilical means the belly button, so it's literally the dead center.
Mm-hmm.
Okay. The one just above it in the center is the epigastric region, right? And epi told us what? I don't know if you remember that from like prefixes.
I don't. Epi. Is it upper?
It is. So to be above, right? So literally it is above, right? And gastro is the stomach.
Mm-hmm.
Okay, so epi is above the umbilical. And then hypogastric or hypogastrium. Okay, hypo is the opposite of epi. So hypo means it is, if epi means it's above.
Oh, the lower.
Okay, hypo means it's below. Okay, so it literally tells you in part of the word, right? This is the epigastric, right? Hypogastric, so it's above and it's below that middle section.
Okay.
Okay, and there's a couple of these pictures to label in the homework, so you'll kind of be able to refer back to these pictures and make sure you got them in the right locations.
Okay.
And I'll post the PowerPoint too, so you can see the PowerPoint. Okay, so for the 2 side sections, again, you're going to see everything here is labeled right.
Mm-hmm.
Everything here is labeled left. And why was it opposite again?
Because it's their right and their left.
Okay, so patient right, patient left. But you'll see the other words are exactly the same other than the right and the left.
Mm-hmm.
Okay, so the top section is referred to as the hypochondriac section. Okay, which means below, and chondrio is the ribs. Okay,
Mm-hmm.
so this is the right, this is the left. All right, next is the lumbar. Okay, and lumbar is that lower, like, spinal cord region, like where your back sort of curves in. We're going to talk about that next week. Okay, but that is the right lumbar, the left lumbar. And then iliac region. Okay, iliac is that top portion of your hips. So like if you stuck your hands on your hips, that's the iliac bone. Okay, so we call this the right iliac region, the left iliac region.
Mm-hmm.
Okay. So any difficulty with just the basic concept of that? I mean, I know there's like memorization that has to be done, but...
No, it's under.
Okay. But once you start getting into the homework, I just want to make sure you understood it before we move on to that. Now it's just a matter of you're going to unfortunately have to go and just do the homework a couple of times and make sure you've got the right sections.
Right.
Okay. So next we've got what we call body cavities, and this is a little bit morbid, but if I went in and like scooped out all your organs, what's left behind are these lovely little cavities or openings right inside the patient. So we do give terms for these, okay? The top one is called the cranial cavity, right? And cranium refers to the skull or the brain. Right, so the organ inside there is literally the brain, okay? And then this one down the back is called the spinal cavity because in it would be the
spine.
Ta-da! Okay, that's it. Okay, not real difficult, right?
No.
Okay, this one here in the chest that's kind of like this dark teal blue is the thoracic cavity. And the thoracic cavity would have the lungs, but also has the heart. Okay. All right, then we've got this little diaphragm, which is like a little muscle that kind of separates between the chest and the stomach. Sorry, that's my poor dog crying in the background. My sister came over. She's going to take him to watch, but he hurt her, so now he's all excited. Okay. So the thoracic cavity, right, is separated physically by this muscle, the diaphragm, which is what helps us breathe. Okay. And then we have our bottom section, which is the abdominal portion, which is the abdomen, right? So the stomach we would probably traditionally call it. And
Mm-hmm.
then the pelvic cavity, which is the pelvis, so it's surrounded by those pelvic bones. Okay, so between the abdominal and the pelvic cavity, you'll kind of notice that there really is like no separation at all.
Right.
Okay, so we often refer to this together as the abdominopelvic cavity because there's really no like physical separation like between the thoracic and the abdominal. Okay, so if
Right.
you see it as the abdominopelvic, it's just because there's no physical separation.
Abdominal.
Okay,
Right.
all right. So now let's name some organs. And again, I'll load this picture for you. And I'm not going to name everything here. I just want some big some big organs. Poor little guy is so excited to go. Fortunately, it's my sister Victoria. It's just the two of us who ended up on the call today, so should make it a little easier for her. All right, so we'll start at the top, and we're going to talk more specific as we get into different body systems in a couple weeks. But all right, this number 1 is kind of in the neck. All right, bye, buddy. Go have fun playing, huh? Okay, he's all excited. He gets to go play with his sister. Okay, today, for which he can't get out the door fast enough. I know, because he knows where he's headed. They know when they get to go play, right?
Right.
Okay, so this little guy in the neck. Do you know what that one is? It's a tricky one.
Is it the thyroid?
It is. Perfect.
Oh, right.
It is a thyroid. See, you know much more than you think. Number 2 we would call the windpipe, but it is officially the trachea. Okay. 3 and 4 are just the good old lungs. And do you remember the name of the cavity that was in the chest where the lungs were?
The thoracic cavity?
It is. Perfect. The thoracic.
Thoracic.
Thoracic, but that's okay. Perfect. I'll take it. All right. Number 5 is the aorta, which we'll come see not for a couple weeks, so I'm not going to get too into that. And number 6 is the heart. Okay.
Mm-hmm.
All right. Number 7 was that little muscle that divided the thoracic and the abdominal cavities. Do you remember which muscle helped us breathe?
Lungs. The
lungs help us breathe, but the name of the muscle started with the D and it separated that thoracic and the abdominal.
The diaphragm.
The diaphragm. Perfect. Okay, we then have here on this side, so number 9, it's like this big purple dark organ. That is the liver. Okay, with the gallbladder and this little green sitting right behind it. Okay.
Mm-hmm.
On this left-hand side, patient left, all right. Number 8, this is a good old spleen. Okay. This big pink organ is a stomach. Okay. And then we have some good old intestines. Okay. Oh, I'm sorry.
Mm-hmm.
And number 12 is the pancreas. This little yellow piece kind of sticking behind here. Can't forget about good old pancreas. And we're going to take a look at these organs in particular later. I just want you to have a general idea. Okay.
Yeah.
Okay. Then we've got this large, and I'm kind of outlining it here with my pointer. Okay. This large intestine. And it is, in fact, the colon or the large intestine.
Okay.
And then on the inside, we've got a bunch of much narrower, thinner tubes, which is the
small intestine.
Small intestine. And at the bottom, number 18, we have good old bladder, right?
Mm-hmm.
Wouldn't want to live without the bladder.
Right.
Okay, so just some general organs, right? I didn't ask too many questions on this, but you should have just a general outline of where the organs are.
Right.
We're going to do each of these like in different sections. So digestive, we'll look at all the intestines separately, right? So you'll have to be more detailed there.
Mm-hmm.
Okay. All right, next. I think I've just got 2 more sections to go through. And then I'm going to let you digest, and we're going to come back to this, and hopefully by Tuesday it's all sort of in there.
Okay. Yeah.
Okay. I know I'm throwing a lot at you at once, and we're not even like face to face, but.
Oh no, this is beneficial. It is.
Okay, good. All right, and then I'm going to post the video, so if you are like an auditory person, you can always rewatch it again.
Okay.
Okay, so there are three essential ways to slice up the body. I'm going to pull up a slightly better picture than the one the textbook has. All right, we often refer to these as planes of the body. So we're a 3D being, so there's really three ways we could sort of, and I'll show you some like X-ray images in a moment, but there's really three ways that we sort of divide up the body. Okay, and the first is generally the easiest, and that's this transverse or this horizontal plane, which here is kind of in green. Okay,
Mhm.
here is in green. They're all kind of in green, I guess. Okay, but the horizontal or transverse plane cuts us into a top half and a bottom portion. So you see it kind of like cuts us straight through that waist and
Right.
separates out like the top versus the bottom. Okay, then we have the sagittal plane, which here, right, is kind of in this red sort of color cutting down the center.
Mhm.
Okay, the sagittal plane divides us into a right and a left half. So imagine it like coming straight in towards us, dividing our right side separate from our left side. So it's almost like slicing us right in half.
Mhm.
All right, then our coronal plane or our frontal plane kind of comes in sideways. So on this picture, it's this dark blue one. Okay, and it divides us from a front half and a back half.
Right.
Okay, so why this is important is mostly when we talk about like images. Let's see. Find a brain image. I know they make them. Okay, so if we're looking at CTs, MRIs, that sort of stuff, you will
Mhm.
see again, right? This is the coronal or the frontal, right? Divides front from back, horizontal, top from bottom, and sagittal, right from left.
Mhm.
But if we're looking at x-rays, images, slices, okay, so this top one here, okay, is that the sagittal. So we're actually dividing it into a right and a left side. So as you look at it, right, it's a much different appearance than this one, where we slice this one transversely this way.
Right.
And it's like we're looking into the brain
Mhm.
versus this one, which is that frontal or coronal plane, where we're almost looking like we've taken off a piece and we're staring straight at it. Okay. So when you see these terms, I'm not going to get crazy about these, so don't get like super worried. I
Okay.
just I just want you to know that okay, this is a tough concept, and we're going to come back to this again on Tuesday. Um, so it gives you a little bit of time to kind of work into the homeworks a little bit
All right.
and sort of like give you a chance to see if you're sort of grasping it or not grasping it. But most of this comes when we're doing like X-rays, MRIs, CT scans, like autopsies. What they're really telling you with that terminology is which way they sort of cut the object
Uh-huh.
so that you can see different pictures, right, and different sort of views.
Right.
Okay, so let's see. Okay, so here's just two of them, but you can see this is sagittal, right? So that's the right to the left, right? That was horizontal, like we're staring down.
Mhm.
This one also had a frontal here, right, or that coronal. So you can see that because we're 3D beings, if we cut in different ways, we
We
get
get
very
different
different
views.
pictures. Yeah.
Mhm.
Okay, so that's why we use those terms, is just to sort of tell us which way do we sort of look at our patient.
Okay.
Okay. Don't let this be like your end all be all of right, things you have to know. I would say for this chapter, um, two biggest things so far is the cavities and the quadrants. And in fact, in the purpose games that I linked to you guys, there's those games are in there, right? So if there's a
Okay.
purpose games to it, I would make sure that you like know that stuff. So I did like the abdominal regions as a game, right? I would make sure you understand those.
Okay.
Okay? Because that's going to be huge. Okay? This is just something that's interesting, but it's only 3 things. You'll kind of survive past it if you didn't kill yourself over it.
Okay.
Okay. The last thing, however, that you really, really have to know is this what we call anatomical directions. And again, there's a purpose games for it. It's a matching. Okay, so of like the biggest 2 things I would spend time with, it's those abdominal regions and directional terms. Okay, because this is like stuff you will be doing every day for the rest of your life, right? Putting it into your soap notes and reading it and looking at reports for it. Like this is your everyday, okay, sort of stuff are those 2 big things. Okay, so if you had to like super focus on what do I memorize this weekend, these 2 things would be it. Okay, these
Okay.
terms are also in the word list. So if you just go to that Quizlet word list for chapter 2, right, these words I'm going to talk about are all in this word list, plus they're in that little tournament for purpose games.
Okay.
Okay. All right, so this is the body, and you can see the right and the left, and it again is patient right and the left, but there's all these crazy terms. Okay. And it's how we describe things on the body. So we're going to start, and they always come in pairs of 2. All right, so we're going to talk about the terms always in pairs of 2. So we'll start with what I think are the 2 easiest, which is superior versus inferior. And superior really means to be on top of, above something, right, towards the top.
Mm-hmm.
Okay, whereas inferior, okay, means then to be below, on the bottom, right under something. Okay.
Right.
So let's say a patient comes in, and this is common, right? Kids fall. I used to deal with athletes. They'd punch each other, and then they'd cut themselves just above the eyebrow. Okay? Well, we don't want to say there's a cut just above the eyebrow. That's not really medical, okay, anymore. What terms might you use to sort of describe that cut?
Thus, it's superior?
It is, right? So, has a cut just above the, just superior to the right, eyebrow, just superior to the right eye, just superior to the right, okay? Something of that nature, okay?
It's superior. Mm-hmm.
Right? Versus, let's say a kid was playing around, bit through part of that lower lip, so it's just under the lower lip. How would you medically describe that now?
Inferior of the lower lip. I mean, of the bottom lip.
Yeah, I would just say inferior to the lips in this case, because inferior already means,
Bottom, right.
yeah, to be lower or bottom. But it helps you to be very specific if you're describing where somebody's in pain, where they cut themselves, where the burn is, right?
Mm-hmm.
It's always better to be more specific as opposed to less,
Big.
right?
Mm.
Unfortunately, superior and inferior have some additional terms, okay? Another term for superior would be cephalic, okay?
Mm-hmm. Cephalic.
Yeah, cephalic. And it's just, you can see it's in parentheses. So it literally means the same thing, okay, when you see it like that.
Okay.
Okay. And inferior, another term to be inferior is caudal.
Caudal.
Caudal. Yeah. So it's on, and I'm going to give you the PowerPoint so you don't have to, and it's in the word list, so it's not, right?
Mm-hmm.
Okay. So just know that those are other potentials, right? Although superior and inferior 99% of the time are the terms we're going to use.
Okay.
Okay. All right. Then we're going to look at medial versus lateral. All right. So on this lady, you should see this little white line kind of right down her center. And that's just to tell you that's like the dead center of this woman.
Right.
Okay. So medial is pointing towards that line, and lateral is pointing away from that line. All right, so medial literally means towards the middle, and
Mm-hmm.
lateral literally means pertaining to the side or towards the outside. Okay.
Okay.
So now let's do a couple examples because this is where, right? Okay, so you sprain your ankle and it hurts more on the inside bump than the outside bump. Well, superior and inferior don't really apply here, right?
Right.
It's not above something, it's not below something, and none of the other words we're going to talk about make any sense either. Okay. However, the bump is on the inside, so how might we describe that?
Medial.
It is more medial. Versus they come in and that pain is more towards that outside bump, which is
Lateral.
lateral. Okay. So someone comes in and they're like, my knee is really sore. It's the inside of my right knee. How might you describe that?
Medial.
Okay, so the medial portion
And
of the knee. Yeah.
mm-hmm.
They have tennis elbow, and that is the outside portion of the elbow.
Lateral.
So that would be the lateral side of the elbow. Okay, does that
Mm-hmm.
make sense?
Yeah.
Where
Mm-hmm.
it's like in a joint where it really has an inside and an outside portion?
Right.
Okay, so the inside would be medial, the outside portion would be lateral.
Right.
Okay, so next are these two terms, proximal and distal. And proximal and distal only apply to the limbs, so we're never going to use it on the head, the chest, the abdomen, the pelvis. It is only for like the shoulder to fingertips, hips to toes.
Okay.
Okay, so just know that if you're looking at something on the abdomen, these two never come into play ever. Okay, it's
Okay.
only for the limbs. Okay, and proximal means to be literally closer to the point of attachment or closer to the shoulder or hip. And distant is further away, so it means to be further away from the point of attachment. Okay, so let's look at some examples. So let me... All right, so the humerus is that bone in the upper arm, okay, which you don't have to know quite yet, okay, so no
Okay.
fears. But it goes all the way from the shoulder down to the elbow, right?
Mm-hmm.
Okay. So if somebody comes in and they fractured it at the shoulder side, is that the proximal or the distal side?
Proximal.
That is the proximal side. Now, if they fractured it all the way down by the elbow, it might be described as the
Decimal.
distal portion. Okay? And it really just, is it closer to where it attaches at the shoulder or is it further away? Okay, if you're comparing the shoulder to the wrist, right, the shoulder would be described as being more, what?
The peak.
Proximal, okay? Whereas
Proximal.
the wrist is
Distal.
distal. What about the knee versus the ankle? The knee would be more
Um. Proximal.
yeah, whereas the ankle would be more
Distal.
distal. Does that make sense?
Yeah, that
Oh,
makes sense.
okay. And again, there'll be homework assignments. There's those purpose games. A lot of this is just you have to use them over and over and over again.
Mm-hmm.
Okay. And we'll keep practicing over and over and over again, so no worries. Okay.
Okay.
Okay. This one unfortunately didn't have the second picture with it, so I'm going to pull this up over here for you. Okay, so we've looked at that picture. So now let's look at this one here, more on the right-hand side. And you can see this gentleman now is kind of standing to the side. And there is one arrow pointing more towards the front of him and one pointing more towards the back of him.
Mm-hmm.
Okay, and towards the front is a term we call anterior. Okay, so let's say that they've got a burn on their chest and it's on the front portion. We would describe that as what?
Anterior.
Anterior. But if they burned the chest region, so something with the ribs, but on the back,
Posterior.
that would be the posterior side. Okay, so it literally is just front versus back. Okay, and again, just like we saw in that other picture I showed you in the PowerPoint, there's those little things in parentheses. Another term for anterior is ventral, right?
Okay.
So anterior and ventral mean literally the same thing. And posterior and dorsal mean literally the same thing because, of course, we want to make sure that you're nice and confused. Okay, right? Right, just like superior and caudal and inferior and cephalad, right? Okay.
Right.
Right,
Right.
anterior and ventral, posterior and dorsal.
Dorsal.
Okay. Literally the same thing. And again, no worries. The more you play either the games or just use them in the homeworks, it starts to fall together. Okay. All right, then the last terms, which I think are actually pretty easy, are superficial versus deep. Right, so superficial, like a superficial wound would be where?
Above.
Yeah, so kind of just at the surface, right, of the body. Whereas a deep wound
Would be
would be just that, right? Something further in. So superficial just means to be towards the surface, whereas deep means to go in nice and far.
mm,
Okay. Okay. So, um, directional terms is the name of that game, right? Which kind, and I would absolutely play this, right? And
mm,
the tournament goes for 5 days, and I can extend that, but you'll still be able to play this as much as you want. So
okay.
essentially, what you have to do is then match, right, one to the, okay, other.
Right. Okay.
Okay. Oh no, I got a 0, so no cookie for me. Okay. Terrible. Okay, so we went through quite a bit for chapter 2. Okay.
mm,
However, two biggest things I would absolutely understand because you need to know them for anatomy, you'll need to know them for everyday job. Okay, are those anatomical directional terms
mm,
and then body quadrants. Okay, so those two big things are a huge part of your homework. They're part of those purpose games. They're part of the word list. So most of the word list for chapter 2, right, has a lot to do with, right, those things. There's a
right.
few more that we'll kind of do and practice on, but all right. Do you feel like at least I know you've got to work on it and memorize it a bit, but does
Yeah,
the
I feel better than I did when I first started chapter
okay.
1.
Yeah. Then at least you've got a general understanding so as you work through the assignments, you can go back and I'll upload this PowerPoint as soon as we're done.
Yeah.
Okay.
It'll be light bulbs going off as I
Okay.
work.
Okay. I just want to make sure that that's the case and that you're not still right confused. Okay, so I'm going to ask a couple of questions.
Okay.
And I'm not going to do them all, just because, right? Not it's just us two on here, but just to see if you got a couple of the questions, and then perhaps we'll do some of these Tuesday as well. Um, all right, so let's take a peek at this little question. All right, so I've got 3 pictures here. Which one of these would be the coronal plane, also known as the frontal plane?
The middle.
It is the middle picture. Perfect. And normally, once we've got a couple folks playing together, and we can still do this one as a review for Tuesday,
Okay.
we can play this all together and you can actually type in your answers. So which one of those terms meant to be towards the middle?
Um,
Yeah.
is it the lateral?
Close. You're on the right, and I spelled that wrong. I added an I there, and it shouldn't be. Um, lateral means to be towards the outside, but you're on the right set of
Oh,
pairs.
media. Okay.
You're on the right set of pairs.
Right. Middle, medial. That's
Medial.
what it
Okay,
is.
yep. So
Yep.
literally,
Medial.
yeah, if that helps you, like that always helped me when I was learning these, right? Medial towards the middle, right? It kind of
Mhm.
sounds like it. And then laterals, it's opposite. Okay. Okay. So I don't want to get too far ahead and kind of overwhelm you too much. I'm going to stop screen sharing for a moment and then I'll stop the recording too. So